nutshell, European health data space for citizens means primary use. So when you go to a doctor, you go to an appointment, someone asks you questions, someone writes about you. This traditional usage of information systems and data is what the European health data space calls primary use. So we're supporting the delivery of care. So when, of course, you don't know if you have a vaccine or not, then you are accessing that information that is supporting the delivery of care because you check, oh, I've got to take it, so you book that. Secondary use, it's all about using data for other purposes. So, policymakers, they have to make decisions. Should we open a hospital here or there? Should we get more specialists in this area or in this other area? Researchers need to find out about, our health, to find new treatments, new approaches, and so on. And of course, many people remember COVID. There's the best example of public health interest. And then an area that is not so obvious for the everyday citizen, but easy to understand. So if you imagine that your data is stored in softwares, in hospitals, in primary care centers in the country at the national level, you wonder, what are these softwares like? Do they follow regulations? Do they follow rules? How were they built to make sure that your data is safe and also can move around the healthcare system in your country, but also around Europe and even outside of Europe? This is what we call requirements for these electronic systems. So the same way you would not like to have a boiler in your house that you're not sure if the people building boilers follow the regulations. So you want someone to define regulations, and you want someone to come and verify if these boilers, for example, or your car, maybe is an even better example, has been designed for purpose and it's fit for purpose. So you want to make sure when you enter a car that everything works. And you don't know the rules. No one knows all the engineering requirements that the car manufacturers have to comply to. And the same way, you as a citizen, you do not need to know many of the things that we discuss in some of these projects, but you need to know that these rules exist because these are the ways to ensure interoperability and standards to ensure what is more important. What is more important is that these systems that provide you the basis of the rights to use and see the usage of your health data for the benefit of your health and of the health of others. So the regulation goes into different details of the rights. And just as an illustration, as of 2 years from March this year, so the full force implementation, we start progressively because there's different components of the regulation that enter in effect in different times. But as Catherine just exemplified, you will have the right to access, see your data, but also download the copy of that data. But for example, also provide a copy of that data to someone else or to another system. And of course, it would take us a long time to discuss these rights. But what is important for you to understand today is that some of these rights are made possible due to the work that XShare is doing, but also in a simplified way, in easy language with the so-called yellow button. And within more technical discussion, and I know the audience is very variant, you then need to know, so what are the key standards, the key rules that I was just explaining that really are important? So they are called the interoperability component and the logging component. When you combine these two, imagine these two parts of the machinery of the car. Okay, one provides the capability of data to move between different systems, different software in hospitals, across countries. It's called interoperability component, and it has different categories of data, which means that maybe in the beginning, we're not capable in Europe to share all the data across all the systems. So we have defined priority. And then the second component is called the logging component. And this basically means to allow you to know who has accessed your information, when, and where. So imagine the system, and these already exist in some countries, where you get an email or you get an alert. Okay, Dr. So-and-so, nurse so-and-so has accessed your record. But now imagine that that system, that capability is now mandatory, because for now it was optional. Some countries have it, others not. And now it becomes mandatory, but also harmonized. So even if a Greek doctor or Greek nurse sees your data and you are in Lisbon, the same would apply. And then finally, the idea that this regulation is not a big bang. It's not going to happen from one day to the other. There's progressive implementation, and for all of you that have to get ready to this, and all of us as citizens have to get ready, because we have to get ready to demand, to require, to request, to force, to ask our hospitals, do you comply? Are you ready? And if not, we need to exert, as I normally call it, these digital rights. That called health data activist movement is really key. But for you to understand, so there's a very complex steps. We have to detail the regulation in concrete instructions for the different actors of this complex ecosystem to know what they have to do.